Hepatitis C is a viral infection that affects your liver. It can be acute in the early stages within the first 6 months, or it can become chronic after 6 months, and it can last for decades if it remains undetected and untreated. Many people, when they get hepatitis C, acute hepatitis C, they don't know what the symptoms are. Sometimes even their doctors don't know what the symptoms are because they're very sort of vague and general. Sometimes people don't even have any symptoms. Chronic hepatitis C can really damage the liver through inflammation. And so let's say you didn't catch your hepatitis C when it was acute, when it was less than 6 months, and now you have chronic hepatitis C. First, the tissue becomes inflamed and some of the cells stop working. After a certain amount of time, the liver can get scarred and big amounts of the tissue can stop working. Over time, the whole liver can stop working, and this can cause all kinds of complications leading to death even. Basically, 70 or 80% of people with acute hepatitis C just become chronic. The other 20% of people fight it off. It's like people who fight off COVID and never get sick or never get COVID. They fight it off before it becomes clinical. Good for them, but a lot of people don't. So who should get tested for hepatitis C? Certainly everybody between the ages of 18 and 79 should get tested for hepatitis C at least once. If you're in one of these groups, we call them high-risk groups, such as people with HIV, people who inject drugs either before or now, people who are on hemodialysis when they have kidney failure, some people who've gotten blood transfusions in the distant past, say in the 80s, so the older population, may have all been exposed to hepatitis C. And so it's important to understand what some of these risk factors are. And it's important to tell your doctor, if they don't already know, what some of these risk factors might be as they relate to you. And you shouldn't worry about being tested for hepatitis C. It's a very treatable disease. And because it doesn't cause symptoms, everyone should be tested for hepatitis C. In fact, the CDC and the United States Preventive Services Task Force that makes all of our guidelines about what diseases we should screen for now include at least getting tested once for hepatitis C. You shouldn't be afraid because we have great oral medications and we can cure hepatitis C, but you have to take the first step with your doctor and get tested.